Remove the temporary restoration. If required, clean the preparation with a polishing brush and fluoride-free cleaning paste, for example, Proxit fluoride-free. This will remove remnants of the temporary cement. Then rinse the preparation with water spray and dry it with blown air. Avoid overdrying. For ideal aesthetic results, you can test the shade of the restoration in advance with the help of the Variolink Esthetic try-on pastes. Apply the try-on paste onto the inner aspect of the restoration and place it in the patient's mouth. Check the accuracy of fit and the occlusion of the restoration. Afterwards, rinse off the try-on paste thoroughly with water spray and dry the restoration with oil-free air. If the restoration has already been preconditioned in the laboratory, clean the bonding surface with Ivoclar. Shake the Ivoclar bottle and apply Ivoclar in a covering layer to the entire bonding surface of the restoration using a microbrush or brush. Allow Ivoclar to react for 20 seconds. Then, rinse off Ivoclar thoroughly with water spray and dry the restoration with oil-free air. If the restoration has not been preconditioned in the lab, sandblast the inner aspect of the IPS Emax Zircad Prime Aesthetic Restoration with aluminium oxide particles sized 70 to 110 micrometers at a pressure of 1.5 bar. Rinse the restoration thoroughly with water spray and dry it with oil-free air. Apply the Universal Primer Monobond Plus onto the pre-treated bonding surface using a brush or a microbrush and allow the primer to react for 60 seconds. Subsequently, disperse Monobond Plus with a strong stream of air. When using adhesive cementation, a reliable isolation of the treatment area is essential. For isolation, you can use the lip and cheek retractor Optragate in combination with cotton rolls and a saliva ejector. Clean the preparation again with a polishing brush and a fluoride-free cleaning paste, for example with Proxit fluoride-free. Afterwards, rinse the preparation with water spray and dry it with water and oil-free air. Avoid overdrying. Apply Adhesive Universal on the entire bonding surface and scrub it into the surface for at least 20 seconds. Start with the enamel surface. Now disperse Adhesive Universal with oil and water-free compressed air until a glossy, immobile film layer results. Avoid pooling of the adhesive. Light cure Adhesive Universal for 10 seconds with a curing light at a light intensity of at least 500 mW per square centimeter, for example with the Blue Phase Power Cure. Apply the desired amount of Variolink Esthetic DC from the Auto Mix syringe directly into the inner aspects of the crown. Place the restorations in the patient's mouth and secure firmly with consistent pressure. Light cure excess cement for 2 seconds per quarter segment, for example with the Blue Phase Power Cure in the pre-cure mode. Ensure that the distance between the light guide and the restoration is no greater than 10 mm. Now you can easily remove the gel-like excess material using a scaler and in proximal areas with dental floss. Like any other composite resin, Variolink Esthetic DC is subject to oxygen inhibition. To avoid this effect, cover the restoration margins directly after removing the excess material with glycerine gel. Liquid strip is ideally suited for that purpose. Afterwards, light cure all cement lines again for 10 seconds per segment and millimeter of layer thickness at a light intensity of at least 1000 mW per square centimeter, for example with the Blue Phase Power Cure. Now rinse off liquid strip. Finish the proximal areas using finishing and polishing strips. Check the occlusion and functional movements and make adjustments if necessary. Polish the restoration margins, for example with Optragloss. Finally, apply a thin layer of the Oral Care Gel IPS Emax gel directly onto the gingival area of the cemented crowns. Use a Viva brush or brush for application. Remove the lip and cheek retractor and the cotton rolls.